how do dumbbells help? And actually, always remember that if you don't have dumbbells, a great option is 2 water bottles, and you use them as dumbbells. You just kind of bring them up, and they're each, maybe half a pound, and it works. So it's a good option in case you don't have dumbbells. Don't spend the money. But doctor, how does that help?
Absolutely. So in the beginning, you can just use body weight or gravity resistant exercises to start. But once you get advanced, people get kind of overwhelmed by going to the gym and starting with which weights. You can easily talk to your therapist and learn the exercises, talk to your physician, have some guidance in what you're going to do, especially if you're going to do something more advanced like Pilates or yoga. You should definitely have a coach or a teacher. And then once you get to the point where you need some weight, using things at home are great. For example, milk jugs or water bottles are great resistance tools to use at home.
Now, when it comes to age, let's also note that the exercise will differ, right, doctor, depending on whether you're talking about an elderly person, a more sedentary person, a more active person, or maybe even someone younger. All of these are different categories, right?
Correct. So it really depends on the patient and what they want to do. So as a physical medicine rehab specialist, I really focus on function. So I try to get an idea of what the patient is doing, what they were doing before the pain, what they want to get back to. So one big thing that I see is fear avoidance activities, or kinesiophobia is the medical term for it. And that's when you see somebody that's afraid to move, afraid to bend, afraid to walk because they twisted one time and the pain was severe. And that's really what these exercises and stretches, either a physician-guided home exercise program or physical therapy, which is a therapist working with you, teaching you how to exercise, how to move without causing pain. Some people think that they're going to harm themselves if they're doing therapy. You're probably not going to harm yourself as long as you've been cleared by your primary care physician or a spine specialist. You may hurt, but it's going to be a different type of hurt, and we really have to have a conversation together to learn what works for you and what exercises work for you. And specialists like myself, or sports medicine physicians, we really try to get you returned to sports or return to your prior level of function.